Madam, please. Hello.
Yes, sir. Hello.
Can you hear me? Yes. Yes. Good evening, good afternoon, and good morning. This is the 1608th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, yes, HUANG WEI LING from Brazil. And let us begin the session with 1 minute silent prayer. Please wait, please wait. I shall speak from my phone. Please wait. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi, and the second session is an international session which we began at 8:30 to 9:30, and from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself so that you can watch it again and again. And if you miss the videos, you can subscribe the same at YouTube without paying any money, and you can go ahead with the sharing the same without paying any money. And let me come to today's guest. As you know, the our guest of the day is a very important person from Brazil, and Dr. HUANG WEI LING has completed her study in medicine. It's from Brazil, and then she studied Chinese medicine, traditional Chinese medicine, as well as yoga and naturopathy. And then she is going with the studies. Then she completed profession with homeopathy also. So she is a holistic person. She is treating in a holistic way, using all these systems together for the betterment of person. That will be very, very beneficial to patients around the world. And since 1977, she works with the approach of treatment of all chronic diseases in a holistic way, and treatment guided through teaching of traditional Chinese medicine and Hippocrates. She is an author of the theory of constitution of homeopathy of 5 elements based on traditional Chinese medicine. She is the author of more than 230 publications about treatment of variety of diseases, rebalancing the treatment energy. Anyway, today doctor is talking about prevention of diseases in pregnancy using homeopathy and TCM. She has presented many papers in this forum, and all the 4 presentations were extremely brilliant one. So with that, we can invite our guest of the day, Doctor. Welcome. Yes, yes, you are co-host now. You can go ahead. There was some network problem with my laptop from the very beginning. That's why I find it very difficult to begin the session. Okay, now it's all right.
Okay. Can you hear me now?
Yes, yes.
Yes. Okay. Thank you for introducing me, Dr. Danesh, and thank you for inviting me to come again in this IFPH forum, continuous presentation. It's my pleasure to be here again and present another study titled, How Can We Prevent the Formation of Disease in Pregnancy using Homeopathy and TCM Reasoning. I would like to share the screen.
Yes, yes, you can share the screen.
I don't know.
Yes, yes, it's coming, it's coming.
It's coming.
Yes.
Can you see the data show?
Yes, yes, yes. You can make it
Yes.
big. Yes, everything fine. You can make it big screen.
Okay.
Okay, fine, fine. You can go ahead.
Pregnancy has it's this condition where the baby is growing inside the mother's womb. But what I want to say is that prevention of disease in pregnancy, we need to treat the patient if we can before the pregnancy, because in this situation before the pregnancy, nowadays, the majority of women in this world is suffering from energy deficiency situation because we are facing a state of immune deficiency for about 10 years, since 2015. And that's why if we do not treat this condition before the pregnancy, the gestational period could have some problems. This presentation will be following Hippocrates that said that foolish the doctor who despises the knowledge acquired by the ancient. Hippocrates said that we needed to use the ancient medical traditions prior to the knowledge we have nowadays. The medicine we are practicing today has about 102 to 20 years. And homeopathy, since Samuel Hahnemann, exists for about 250 years. And what I want to say is that our world changed from the past to today because of modernization of the telecommunication with the implementation of 4G and 5G technology. This kind of electromagnetic radiation leading to more facilitation of our communication is harming our health in a way that we cannot see by the naked eye, because it's affecting the part of energy of the human body. And this part of energy is not studied by the modern medicine because they do not understand. What they cannot see. They only understand what they can see through the laboratory exams or through radiological alterations. And these alterations do not appear in the first 5 or 10 years of energy alterations, and only we can notice these alteration when the patient has some disease. And this article that I wrote, published in 2023, 2 years ago, saying that we are facing a new global immune deficiency where I measure the energy of the 5 internal massive organs of the 5 elements theory of traditional Chinese medicine, measuring the energy of liver, lung, heart, spleen, and kidney of 1,000 patients in my clinic in Brazil before the pandemic, the COVID-19 pandemic, from 2015 to 2020. And I concluded at that time that 90% of all my patients were in the lowest level of energy in all these organs before the COVID-19 pandemic. This shows that we had the COVID-19 pandemic because we were immune deficient. Because if our energy was normal like in the past, we could not have the disease formation of COVID-19 in this whole world, because our immune system could be working normally and could be fighting against the invasion of any kind of viruses or any kind of external pathogenic factors. And this is another article that I'm showing that how are the clinical characteristics of women in this new global immune deficiency. The majority of the disease that we are treating nowadays has in common this energy deficiency situation in all these 5 internal massive organs that I want to show, repeat again, through this metaphor of this tree. This tree is, I created this tree, and this tree is a symbol of what I want to transmit in all my articles, in all my presentations, to show the different viewpoints between Western and traditional Chinese medicine. And you can see this tree symbolizing the human body also. And this tree is divided into parts, the part above the earth and the part under the earth. The part above the earth is what Western medicine is focusing their diagnosis and treatment. And what I want, this tree has a trunk with several branches. Each branch means one medical specialty, and coming out of each branch, you can see many leaves. Each leaf means one disease or symptom treated by each medical specialty. In this case of pregnancy, it's branch of gynecology and obstetrics. And each disease that coming out, you can see that could be diabetes, could be gestational diabetes, could be preeclampsia, could be thrombophilia, could be fetus, some alteration in fetus, and many diseases are in this leaf level. But in traditional Chinese medicine, they understand that all disease in the leaf level, the problem is not on the leaf level. The problem is on the root of this tree that I will show to you the history that began this kind of reasoning. This reasoning began in 2006 when I treated one specific patient, and he was a 70-year-old male patient that was suffering pain in the legs for the last 6 months with no improvement, only using anti-inflammatory medication. And he went to my clinic. Instead of treating his symptoms, I treated his energy alterations presented in this root. And after this treatment, treating his energy alterations presented in the root of this tree, he returned and said that, doctor, my leg pain improved, and but also improved another condition that I was not aware. He had been treating for glaucoma for the last 40 years with no improvement of his condition, only using eye drops. And for the first time of his life, when I treated his energy alterations presented in this root, he improved from his glaucoma condition that his intraocular pressure was 40 for the last 40 years without improvement. And only treating this root, it was possible to reduce his intraocular pressure from 40 to 17 mmHg. He improved two conditions, the leg pain condition and also the glaucoma condition, when you can see that all these diseases came from the same root of these tree. So in the root of this tree, there are two theories that are yin-yang theory and the 5-element theory. Yin-yang needs to be in harmony in all patients. So in pregnancy, woman, it's very common, you see that in pregnancy, they present cold feet and cold hands, or hot feet and hot hands. These mean yin and yang energy alterations when the patient has. When the patient has cold feet, these mean that she has yang energy deficiency. When she has hot flashes and hot sensation, this means that she has an imbalance of yin and yang. She has yin less than yang. And the aim of the treatment is to balance these two forces to achieve this equilibrium again, because all disease in any kind of disease without pregnancy or in pregnancy, we need to, the aim is to achieve this balanced state between yin and yang. For example, when the patient has cold feet, they have yang energy deficiency. Yang energy deficiency is when the patient has liquid retention, urinary incontinence, could have obesity. And the treatment, the first thing in this treatment is to change the dietary aspects to give more hot water to increase this to treat this coldness inside the patient's body. And when the patient has energy deficiency, this is one of the alterations that is leading to the formation of a gestational diabetes in Chinese medicine. And that's why we need to orientate the patient to avoid some foods that can reduce even more the yin. For example, the ingestion of soft drinks, coffee, mate tea, all these will keep this imbalance between yin and yang. The second theory in the root is the 5-element theory. The 5 elements corresponds to water, wood, fire, earth, and metal. Water represents kidney, wood, liver, fire is the heart, corresponds to the heart, earth corresponds to spleen, and metal corresponds to lung. Each organ is responsible for the production of one internal energy for our health and for our immune system. For example, one organ is responsible for one external sensorial organ, and the water element is responsible for the ear and hearing process, for the reproduction, for the sexuality, for the teeth, for the memory and concentration. And wood element corresponds to liver. Liver is an organ responsible for vision and eye and vision. And for example, when the patient has problem in the eye, we do not treat the eye itself, but we need to treat the wood element. The fire element corresponds to the heart, and the heart is responsible for the sleeping process and the communication. And for example, when the patient has insomnia, it's very common to see the lack of energy of the heart, leading to this difficulty in sleeping. And that's why if we treat this condition, the pregnancy woman or the woman in general could return to have a normal sleeping process. Very important for to restore our energy during the night, to preparing to work in the next day. And the fire element, when we do not treat this condition, the lack of communication that we see in autism patient is caused by this lack of energy in the fire element. And the earth element, the spleen. The spleen is responsible in Chinese medicine to the absorption of nutrients and formation of blood. And as I showed to you, all these elements are nowadays very weak in energy. And that's why if we do not treat this condition of this energy of these organs, for example, here is the spleen is responsible for the absorption of nutrients and the formation of blood. And blood is very important for a pregnant woman because blood is the energy that will grow, lead to growth of the fetus and the baby in the womb. And without a proper absorption of this nutrient by this element, this can result in blood deficiency, leading to more propensity to have disease in the mother and the baby also. And the metal element is responsible, it's the lung, represented by the lung. And lung is responsible for the skin, the hair, and the production of qi that is important for distribute all this energy to the entire body. And this is what I want to show to you, that this is a cornerstone of a treatment in traditional Chinese medicine that we need to understand. This is the main thing that we need to know, that yin and yang, yin is leading to yang, yang is leading to qi, qi is leading to blood, and blood is leading to yin energy. And this yin and yang is produced by the kidney, qi is produced by the liver and the lung, and blood is produced by the spleen. And all this is distributed by the energy of the heart. And as I showed to you, the majority of people nowadays do not have energy in these 5 internal massive organs of the 5-element theory of traditional Chinese medicine. And that is why we need to understand that if we do not treat this condition of energy deficiency situation, there is a formation of internal fire inside the bodies of the patients, leading to anxiety, diabetes, panic syndrome, hypertension came from this energy deficiency situation and this formation of internal fire. In this presentation, I will show only 2 case reports. The first is a 32 years old woman. She is my sister. She was, my sister is 18 years younger than me. And she became pregnant, but she needs to have some treatment to have this pregnancy. Why? Because when she get married, before she get married, I measure her energy of her 5 internal massive organs and also her husband. And she did not have any energy in all these organs that I told to you of the 5 elements. But she didn't treat at that time. And she had problems to have babies after. And she lives in São Paulo, 500 kilometers far from me. And she didn't tell me that she was having these problems to have pregnancy. But after having pregnancy, she developed gestational diabetes in 21 weeks of this gestational period. And this was the result of her measurement of her chakras energy centers, and do not have energy in liver, in kidney, in heart, in lung, in spleen. Memory and concentration was also lack, and the spiritual chakra also. And it was very difficult because she didn't tell me about her problems, and she treated only the leaf level using the modern medicine treatment. And she still did, and she had twins, and one of these twins has autism. And that's why I want to show to you that if she had treated her condition, replenishing these organs' energy using the homeopathy medication, sulfur, calcária, silícia, natrium, and phosphorus, she could prevent and could be easier to her to do not develop diabetes, gestational diabetes, and or development of the autism. But she didn't use the medication at that time. But the aim of the treatment in the gestational period is to recharge these energies, to do not allow some disease to go inside the patient's body, because her immune system could be normal. In this second case report is a 32 years old woman. She was pregnant for the first time, and she was very obese and 246 pounds and 5 feet inch height. And she was having hypertension, preeclampsia, and her measurement of energy was in this situation. And after measuring this energy of these chakras energy centers, I prescribed the medication, but the medication to use in this situation. But she did the cesarean section to take out the baby because her blood pressure do not reduce. And the doctor thinks that if he took out the baby, the pressure could reduce, but it's still high after the baby was delivered, the baby by cesarean section. And but nowadays she is fine. She is using the medication, and also we are giving the medication to the baby because the baby is suffering from this energy deficiency situation also. This is another article that I wrote, how can we treat low back pain in pregnancy without using anti-inflammatory medication? Because low back pain in pregnancy, this is caused by low back in Chinese medicine, is caused by the lack of energy of the kidney. And to treat the kidney, we need to treat the whole system of the 5 elements. We need to treat the lung, we need to treat the spleen, the heart, and the liver. This is another article showing blood deficiency as a consequence of postpartum depression. We can see that not very common to see postpartum depression. That patient usually begin to use antidepressant medication, and this is not very good because during the delivery, the woman normally has the lack of blood, is having the lack of many liquids that are delivering with the baby also. And we need to restore all this energy that the patient is having lack of this energy. What measurements can we take to prevent COVID-19 infection in pregnant women? How to prevent COVID-19 without using the COVID-19 vaccine? Because this kind of vaccine can reduce even more the energy of the patient that's already very low also, and can lead to many complications. And one of the measurement is to increase the energy of the root of these organs that we are facing nowadays that are all immune deficient. And if we give this homeopathy medication to increase the energy of these organs, we can prevent the formation of any kind of disease, including the COVID-19 infection. And also in patients with postpartum Bell's palsy after after this is an article that my patient, she had a baby in the hospital, and 1 day after she developed postpartum Bell's palsy. But her energy was already very low, and also caused by the influence of the use of fan and air conditioning during this period that is prohibited in Chinese medicine to be used in this period because wind and cold is the external factors that can influence the patient's body that are very weak in this period, leading to this kind of Bell's palsy. Why I'm saying that the use of homeopathy are the medication of choice in the use in any kind of situation, in this case in pregnancy woman, because the use of any kind of high concentrated medication can reduce even more and can cause even the develop myocardial infarction, strokes, or sudden death in this new type of population that we are treating nowadays. For this reason, the use of high diluted medication is the medication of choice to be used in this new type of population considered immune deficient. And this is another article showing that the children, how is the characteristics of children in this new global immune deficiency. All symptoms presented by our patients nowadays has in common this energy deficiency situation. Oh, here are some other articles showing that the problems, disease in women has in common this energy deficiency situation, infertility, some abnormal uterine bleeding has the major cause of the abnormal bleeding in women nowadays is caused by this energy deficiency in these 5 internal massive organs. And replenishing the energy of all these organs, we can control the uterine bleeding in women without using hormones that normally they use. I want to finalize my presentation saying that homeopathy and acupuncture are considered medical specialties by the Federal Medical Council in Brazil since 1980 and 1995. And they are very important to be used in the treatment of any kind of disease, especially in pregnancy, because we are facing a new type of population that is considered immune deficient due to energy deficiency situation. According to Hippocrates, it's far more important to know which person has the disease than to know which disease the person has. According to him, we needed to treat the patient and not the disease the patient has. Thank you for your attention. If you have any question, I will be very happy to answer you. Thank you.
Thank you, Dr. Huang Wei Lung. It's a very, very important session as far as our presentations are concerned, because you all know that pregnancy, lactation, all these things are very important as far as the life of a woman. And it is our duty to bring the best for those persons who are in need of such things. And as a homeopath, as well as a doctor, as a gynecologist, or even an acupuncturist, or an yoga therapist, the prime duty of the physician is to give the confidence to the patient that you will be having a beautiful child in the future. And once you get a child, baby, that baby will be filling your dreams of life. And for that, all system of medicine, from the medical field can be utilized in a better way if a person know or such things. That's the relevance of knowing about the different systems of medicine in the present arena. Am I right? And you have you are your approach in treating a patient is a different one. That is a holistic one. That means you can use a different a system of medicine for a particular patient itself, not the medicines alone. You can either use the homeopathic medicine or an allopathic medicine, whatever maybe the person prefer. In between, you can allow the patient to go for yoga or at Chinese therapy or the so-called acupuncture therapy or your five element theory concept also. All these things bring the patient health, back to normal or in a better way. And that's
Yeah.
then what are the things you advise for a patient when a person get pregnant, whether you allow the patient to take some supplementary medicine, supplementary vitamin supplements, or simply you allow the patient to go with the good food, diet, all these things? And what kind of exercises you give to your pregnant woman? Follow me or not? What kind of exercises do you advise your pregnant patients, and what kind of
What kind of vaccines?
no what I meant is what kind
Supplements.
whether you give us
Supplements, normally, normally the supplements, the vitamins are considered high concentrated medication also, and they can reduce even more the energy of our patients. That's why the vitamins could reduce this, and you need to prescribe with caution, because this vitamin could reduce the energy, and when reducing the energy could cause myocardial infarction. That's why the vitamin that I'm using nowadays is all quantic vitamin. It's not high concentrated vitamins. Okay? This
okay.
is very important to understand, because I had a patient that was treating cancer, and he disappeared for 2 months. And I asked him, "Oh, well, where were you?" And he said, I went to do a treatment with vitamins. And his prostate cancer was 0 before this treatment, and went to 25 after this treatment with vitamins. And
Oh,
the vitamin, we needed to take care of it, and prescribe with caution, because vitamin can worse the condition
yes,
also.
exactly. Unfortunately, people believe that it is a high time to take these things, and that is very good for health. But natural, they don't know. Well, that's the reason why the number of cancer patients are increasing day by day, and
Yeah.
it's a very pathetic. We are in a pathetic world. We cannot say we when we used to tell the patient that you don't take this much of thing for your health, but they believe they were given such an education that you need this thing, that thing, you have to take this for
Yeah.
2 times, 3 times like that. That's the reason. So it is high time from the physicians of homeopathy and from I system work together to make sure that nobody is taking undesired supplements.
Yeah.
Yes, we will have to make sure that the patients are given only the right medicine, right remedy, and the right food required. Madam, one thing I would like to ask is that whether you allow your pregnant ladies to have sex during pregnancy, or whether you tell them better to avoid intercourse like that. What's your opinion on that?
During sexual life during the pregnancy.
Yes.
Yeah, if she depends. Normally, when they want to have the sexual activity during pregnancy, I think no problem. I think no problem. But this activity will reduce the energy of the kidney. And the kidney energy is very important to keep the energy of the pregnancy. And if you do much sexual during pregnancy, the woman could cause more energy deficiency in this kidney. And that is why you don't do so much,
Yes.
okay?
Yes. Well, that means that you are allowing your patients to have sex during pregnancy, but with a caution. Am I right? Then, what is the situation of homeopathy in Brazil? Whether it is the patients are increasing day by day, or the interest of the people are less nowadays?
Yeah, in my opinion, in my clinical practice, I usually explain the patient why they should use more homeopathy and avoid the other high concentrated medication. The risks of development of complication, myocardial infarction, cancer, diabetes, and that's why it's like ant work. We we work to the population know the importance to use more homeopathy nowadays. And
How
I
many
think
homeopaths are there in your country?
practitioners.
Yes, yes, homeopathy practitioners. How much is there any?
I
Uh,
don't have this information here, but I can bring in the next
Okay, that's
present.
very, because we want to know whether the system is growing outside India also, because here things are entirely different. We have 240 homeopathic medical colleges which teach students, and day by day our hospitals are increasing, and a lot of patients are being admitted in those hospitals for homeopathic treatment alone. And even in government sector, we have a lot of, even in a small state like Kerala, we have more than 1,000 homeopathic clinics under government sector. And all
Yeah.
these, all these clinic, the patient, we have a lot of, a very good number of patients also. So this is what I would like to, uh, that's why I asked such a question, madam.
Okay.
Is what about your friends? A chain of friends who are practicing homeopathy. A lot of,
Here in Brazil?
yes, yes. You are getting any support? Already you have written that it is approved in 1990, and a lot of doctors are practicing homeopathy.
Yes,
Yes.
we are working on it to increase this number day by day.
Is there any hospital there practicing homeopathy? Or
Yes.
only those persons who are practicing private practice, just like you, on the private.
Yeah, we
Okay.
don't have this kind of hospital yet.
If some
know-
people
We
who
know that in Italy they have one hospital that treats only using homeopathy medication.
okay, that's good. Now I invite Dr. Manoj to say something on that.
Thank you, Dr. Ganesh and Dr. Huang Wei Ling, because you are always an energetic person to present. But I think a lot of effort has to be done in that area to improve the practice as well as the government support. I think you are practicing now in Brazil, am I right?
Yes, yes.
Yes, definitely. So we will get no doubt about that. I think they are looking for a socialistic government there, and definitely they will support homeopathy. But what is needed is a campaign effort from doctors of different nations is needed. We are on Kerala, state of India. In one hospital, I recently got information that around 1 lakh patients per year. Then a couple of years back in the Department of Homeopathy, Kerala alone, the outpatient number is 1 crore 64,000. They are 22-23. 1 crore 64,000 patients per year in a small state like Kerala. Just like that, we have a lot of patients and institutions in India, as Dr. Tanesh mentioned. I think now the recent update is around 2,270 homeopathy medical colleges in India. 5 in Kerala in government sector and 1 in the national sector, this National Institute of Mental Research. Moreover, there are a lot of medical companies that are producing medicines also in India. Around 300 companies are there. So all the way developing and a separate system of IFPH is here. So in such a way, you have to adopt. I think after visiting, you must send a team to India. Then you visit all these institutions and will to give some report to the government. Then apply some political pressure on that. Definitely, a nation like Brazil will develop from that. Definitely. Have you got that, Dr. Human?
Yeah,
Have you got?
yeah.
Yeah. Yeah.
Now, Dr. Ram Parvesha.
Uh, Thank you, Dr. Manoj ji and Dr. Danesh ji. Congratulations, Hong Bing Ling.
Uh-huh.
This is a dynamic person and energetic person. Very nice. Describe the prevention of during pregnancy, many kinds of medicine and theory. So very thanks. And homeopathic during pregnancy, prevention of medicine, and 3 times the first antisoric remedy, yani first month give
There is some network failure.
Yes, let's begin. Talk to an important section. Unfortunately, got lost the network.
Ulnam.
Yes, yes.
Mr.
Yes, your network is weak. Anyway, Dr. Huang, whether you are treating acute diseases as well in this way, or only in chronic conditions, you use all these things.
Mm-hmm.
For example, if a person come to you, how you manage the case, whether with these theories or just giving some medicines from the other side, or going with the homeopathic medicine.
As I showed to you, all disease are in the leaf level. And what I usually use in my daily practice is to measure the energy of all these organs to show to the patient that he is suffering from this immune deficiency, that the whole world is suffering also. This is a public health nowadays that we need to understand and treat our patients accordingly. Normally, I usually use that 5 medications, homeopathy medications, together in the same bottle, and the patient will improve from his condition independently on the type of diagnosis that he is having in the leaf level. Because if we treat the root, all the patient's condition would improve at the same time. Even the doctor does not know that the patient has such a symptoms. Okay?
So Dhanesh, I think Dr. Ram Parvesh has again
Uh-huh.
joined.
Yes, sir. Yes, you can speak.
Thank you, disturbance internet. So very, very thanks, Doctor, and congratulations, and prevention of any medicine and easily delivery for the homeopathic medicine is the very good. First month, tuberculum, prevention of child in tuberculosis, and second month, syphilinum ovarium, tuberculum ovarium, and third month, antisoric remedy, sulfur ovarium medicine, and fourth month, dose of carcinosin, prevention of carcinoma and in child, and and fifth month, calcarea car 1m, and 6 month, and 9 month easy delivery colophyllum 30 potency 1 week, and pulsatilla 30 potency 1 week, easily delivery. So very, very thanks, Dr. Hoang Wei Ling. Thank you, excellent session.
Yes, that's a very good information also from Dr. Apresos, because I think giving pedophyllum in the last month of the delivery and last month of pregnancy may be the reason. It is a painless thing.
Dr.
That may be,
It's colophyllum, I think, not podophyllum.
yes. Oh,
Colophyllum.
yes, sorry, pedophyllum. I just, that's why I thought that why this pedophyllum coming into the picture. We know that in prolapse conditions also.
Pulsatilla good, easily delivery.
Yes, that we heard, but
Mm.
that's why I asked such a question. Anyway, it's the time to say what of thanks to the session. I invite Dr. Manoj to say the same.
Thank you, Dr. Dhanesh. So on behalf of IFPH, I'm expressing sincere thanks to Dr. Hoang Wei Ling for coming to the platform and presenting a topic. And I am requesting you to bring more persons, so students and doctors from Brazil to IFPH. Thank you. Right.
Thank you.
Thank you,
Thank
Dr.
you, thank you, thank you.
Thank you, Dr. Ling, and those who participate the meeting. And tomorrow we will have a session from Dr. Sumana Kumari Pandey, and she will be talking about the management of pediatric conditions in with homeopathy.